President Trump is rescinding Biden's executive order on prescription drug costs, a change that could significantly affect Americans with chronic health conditions and fixed incomes.
My understanding of the policy is that it will kind of slow or halt some of the progression that President Biden was making on initiatives to decrease medication costs.
The rescinded order was signed by Biden on October 14th, 2022. It directed the Department of Health and Human Services to modify payment models, reduce and improve price transparency. Medicare beneficiaries were expecting to benefit from cost-saving measures. For example, a cap on out-of-pocket costs for prescription drugs, a $35 monthly cap per prescription for insulin, zero out-of-pocket costs for recommended adult vaccines, and Medicare's ability to negotiate prices for selected high-cost prescription drugs. Senator Catherine Cortez Masto sent me a statement from Washington. He says, quote, President Trump says he wants to lower prices, but just hours into his term, he chose to revoke a Biden-era executive order that pushed to lower prescription drug costs. I'll continue to fight back against any attempts by this administration to raise drug costs for working Nevadans, hurt seniors, or give handouts to Big Pharma, end quote. People with chronic medical conditions who rely on consistent prescription prices and results may have to alter their approach, which leads to negative side effects. Northern Nevada Hope's medical director and PA talks about the negative impacts of missing your prescription.
When a patient is on insulin or any sort of medication specifically for diabetes or any other chronic disease, and they can't afford them, then they will skip doses. They'll cut the medication in half to make it stretch longer, and basically not taking the medication the way that the doctor recommends.
The Inflation Reduction Act, which includes provisions for Medicare, drug price negotiations, and other cost-saving measures, remains law. These statutory changes cannot be undone by an executive order alone and would require congressional action to repeal. Reported in Reno, Nick Doyle, KOLO 8 News Now.